exam, now God you win. And then be say you no go pass, but God you win. You wake up, see today last song, now God you win. Robbers they rob, they no see you, brother. They no see you, my sister. Oh yeah, better fast. God do it, no na God do it, no na God do it, no. Anything I do na God do it, no na God do it, no na God do it, no.
Hello my people, I'm doing a video especially for the nursing graduates. Oh, you guys are making me proud. Thank you so much for becoming a nurse. And guess what? One of my babies, she's in Dubai. She came out as a first-class nurse. I'm so happy for her. Congratulations. Mommy will be so proud of you. Super congratulations. I'm so proud of you. This video is all about nursing with Eunice, and we will be talking about fresh graduate nurses, tips to succeed as a fresh graduate nurse. This may also apply to old professional colleagues as well. My oga dem, agree to now, respect, agree to now. So we want to talk about tips as graduates of nursing. What are the things you should do to help you make your professional journey easier and delightful? And what are some things you should not do? Let's get started. 1. Respect. As a nurse, we are respectful individuals. We respect people, and naturally, they pour back that respect on us. So once you begin working wherever you are posted, do not look down on anyone. The infection control team, which we call the cleaners, the securities, the care workers, all these people are very important to the healthcare, because without them we cannot function. So give them respect. Your matrons, your seniors whom you have met there, they have their traditional way of doing things. You may have learned some new ways in school which you feel is better. But calm down. Don't water down everything they do there and say, oh, it's all rubbish. No, show some respect. If you have any suggestion, it is welcome, but don't do it in a hurry. Gain their trust and politely and respectfully explain what you know and what you would like to see change. And you will be surprised. They will listen to you. They will give you double measure of respect that you have given to them. You will be happier and they will be happy for you. You will be a loved staff by many. Number 2, humility. As a newly graduated nurse, the shoulders will always want to go a bit, because you actually know what you suffered in school to get that certificate. But never mind. Nurse graduates, be humble. Humility. Anyone who humbles him or herself will be exalted. It is not a lie. It is the truth. The fact that you are humble does not mean you are stupid. It only means you are well cultured and that you have a good heart. Because it is easier to be proud than it is to be humble. So you must be humble at all times. Tip number 3, ask questions. Do not be surprised if you get to the world and you see some instruments you have never seen before. You see some customized instruments. Just ask questions and you'll come to see. Hello, guess who we have here? Hello, mommy is shooting a video. Look at that. My son came into the video. He wants to, it's fine. He wants to be here, so it's fine. Let's enjoy the video together. It's fine. Tip number 3, ask questions. Whatever it is you don't understand, ask questions and you will be what? You will be answered. Just do you want to say hi?
Hi.
Hi, yeah. You will be attended to. Don't feel shy, like, oh, if I ask questions, they will feel I don't know it. They'll feel I don't know it. Ask questions. They will explain to you because they are happy that you are asking questions. All right, you want to go and meet Big Six? Okay, go and meet Big Six. So, tip number 3, ask questions. You can't be Mr. Know It All. You can know it all. Even the professors don't know it all. Even the lecturers that taught you in university don't know it all. So when you get to the world, you may see some things you don't understand. You might see some situations, some disease condition that you have never seen before. That reminds me of when I saw someone with what was this condition where you have a dog bite and you go barking like a dog. Yeah, that condition, I saw it for the first time. I have never seen it again face to face. When I was training then, I saw that condition. I was like, wow. The doctors had to like put the drip in the bag, black bags, because the patient becomes hydrophobic. And then hydrophobic means like the patient is afraid of to see water. When they see water, they begin to bark like a dog. I've never seen that condition before. So things like that could happen where you just see a strange condition and you be like, oh, I don't know what to do. Ask questions. Don't be scared. And if you don't know what to do, don't be afraid not to do it. If you don't know what to do, don't do nothing. It doesn't mean you're less of a nurse. You're just a nurse that knows your limitation. Because patient safety and comfort is what? The priority. Yes. If you don't know it today, you will be taught and you will know it tomorrow. So you don't go into problems because your pain, now that you have graduated and passed the professional exams, you will be given a pain. You want to try as much as you can. As you are protecting your patient, you also protect your pain. Because the pain was issued, it can also be revoked. God forbid that happens. So that is why you want to be careful. Ask questions where you don't understand. Tip number 4. Follow protocols. Sometimes we see protocols as being too long, like, for instance, they tell you if you want to give a medication, you check the patient's name, date of birth, allergies, and before you give, you double check again. Like, why do I have to do 2 ID check? I already know this is the patient. Do it, my dear. Because when you begin to work, it gets very busy sometimes, and sometimes the personal affairs are just running in your head, and you'll be like, what did I give? I was supposed to give Mr. A the paracetamol. I went to give Mr. A epizapam for another patient. Oh my God, what have I done? I've given the wrong medication to the wrong patient. It becomes a medication error. What you could have avoided if you have followed protocols. So it's always important. Tell yourself, I will always follow. It might seem like a long way to complete the task, but it is always the safest way. Follow your trust protocols. It is very important. Tip number 5. Always learn to say thank you. Whatever thing someone does to you, whatever thing they show you, they assist you with, end it with a thank you and with a big smile. Thank you. Thank you. People should know you as that happy and smiling nurse. Even when you are tired, be tired, but happy. All right? This is one tip that will take you really far. Because when you tell someone thank you for what they've done to you, they want to do more. Really, they want to do more. Now we go on to tip number 6. Neatness. As a nurse, you cannot negotiate. You have to be neat. You have to be well presented. Aside from the fact that you prevent infection, you protect yourself hygienically and all that, people look at you and they respect you. You don't want to pass by someone and then you smell or you have this kind of body odor. No, you want to wash everywhere, washable, get your deodorant, make sure your uniforms are clean, sparkling, and your teeth are well washed, not smelling, your hair are well combed, your fingernails are well trimmed, everything is just pam, pam, pam. You will like yourself, and naturally, people would want you to attend to them. If I show you a nurse that is neat, and I show you a nurse that is dirty, which would you like to attend to you? Can you choose? It's obvious, you choose the neat one. So as nurses, neatness is one of our core values. You must be neat. Don't say, oh, I couldn't wash my uniform. No, we have multiple uniforms because the salary buys everything in your wardrobe, not so. So spend the salary on your uniform, on your hair first before other things, because you will notice you always wearing your scrubs, wearing your uniform. So if your trust is not providing that for you, you have to buy a set that will last you for a week. So you don't have to wash every day. You cannot negotiate being neat, and don't manage your shoes. It's not bad if you have two pair of working shoes so that when one is going ba ba ba, you can use the other one, all right? And then you air dry your shoes so it doesn't stink, it doesn't smell. You always have socks on your feet to make your feet cozy and nice. You just pamper yourself because you are the nurse you want to be. Enjoy it. Congratulations. Now, tip number 1, 2, 3, 4, 5, 6. Tip number 7. Tip number 7 is read. There is no end to knowledge. Why I'm not telling you go read be a professor, be a this, be a that. No, you can't. If you want to, that's fine, but you should be contented with whatever level of education you want to attain. If you're comfortable with BSc, that's okay for me. My own point is I just want you to be a nurse and you are a nurse. So, but being a nurse does not mean you stop reading. Because you have the pin does not mean you stop reading. You have to continue reading. It's a continuous thing because new diseases are coming up every now and then new way of treating diseases are coming up. Look at malaria. What were we using to treat malaria before? Chloroquine, fancy that. Now we have what? The combination therapy. You just have to keep learning, keep learning, keep learning. When a child is having that diarrhea, cholera, what do we used to use before? Now what are we using now? So you just have to keep learning. And you have to keep reading. I'm not saying you should become a big bookworm, but don't abandon your books. It is very important to update your knowledge as a nurse because we are what? Scientific nurses. That is what we are. We are scientific nurses. And as scientific nurses, we have to continue to read. Yes, very important. And the last tip, your versatility. You should be ready to flow. You can work in A&E, gain experience. You can go to outpatient, gain experience. Cardiac unit, gain experience. ICU, gain experience. When you are versatile, you go to different fields. Then you can now decide, oh, I enjoyed working here. I want to specialize here. So have an informed knowledge before you decide where you want to specialize in. And when you finally decide where you want to specialize in, all you need to do is just politely approach your your line manager, and they will work it out for you. As soon as there is a vacancy somewhere, they will take you to where you want to be because nurses are inadequate in all departments, I must say, and all over the world. So you can't be sure where you like to be. They will post you there and you will love it. Congratulations and thank you so much for being a nurse. Thank you. Big congratulations. I can't thank you enough. Thank you. Thank you. Enjoy it and enjoy the money, the comfort, the joys that comes from it. And the final tip. Never tell a lie or falsely reassure a patient. If you don't understand, it's okay to say you will update them later when you get information. Okay? And if you have to follow the protocol of your hospital, if your hospital protocol is that when a patient does a test, the doctor needs to explain first. Don't jump the gun to explain to the patient that, oh, I know you have malaria. I've seen the results. No. If the protocol says the doctor have to see and explain if it is positive, you have to follow that. If the protocol says if it is negative, you can explain, then go ahead and explain. So hospital protocols is something you must follow. You can't just say, I know it, and you go ahead because the hospital employs you. You have to follow the rules. When you follow the rules, my dear, you can't miss it. Congratulations. This will be all for now. Special video for the new graduates. I hope you like it. I hope it helps. Take care and bye-bye.
Don't pay my rent, God do it. There be one for my hand, but God do it. There be one keep my joy, but God do it. I say anything them do, now God do it. No, now God do it. No, now God do it, no. Anything them do, now God do it. No, now God do it. No, now God do it, no. I don't change my name to God do it. And no more, I don't buy more to God do it. They say my market no go sell, but God do it. And then me say I no go blue, but God do it.